Thank you, Jackie. And when Josh asked me to do this some time ago, I wasn't sure what I should say, so I had a lot of license to do what I wanted to say and on my own. So here it goes. First of all, welcome to beautiful British Columbia. I don't live here, but I live 5 hours by jet plane east of here. So I guess I'm a Canadian, so I can welcome you for another reason as well. Gail and I ski here all winter, and you'll hear a little bit more about that in a few moments. So we know the province and enjoy it an awful lot. And I don't know if you folks, some are from British Columbia. I see your name badges, and so you know all about it, but some are from far away, and if you get a chance to see more of this province, it's quite spectacular. And some of the best wines, certainly in Canada and in the world. I will tell you a little bit about my story first, and I'm a net patient of Dr. Baum's. In 2005, I went to a private checkup here in Toronto, and they saw something on my pancreas. And in 2006, I had a Whipple procedure to figure out what the heck was there, and it turned out to be neuroendocrine cancer. But they thought things were fine, and as you know, surgery is the best approach if you can get it all. Unfortunately, after the Whipple, it came back in a couple of years. I'm going to tell you a little bit about my challenges with the return of my cancer. I went on sandostatin for a while. I was being looked after by a very nice Dr. Krizanowska in Princess Margaret in Toronto. And I remember coming back to a meeting with her, and she said to me, "Well, John, things have not kept under control, and we have to find something else." Well, that was pretty major statement by a doctor to me. It told me that even though she was the expert, she didn't know what the next step should be. So I thought a bit more about it, and I read Maclean's magazine, a Canadian publication, and MD Anderson was listed as the #1 cancer hospital in the world, so I thought I better go there. I did. I went twice. I met with Dr. Yao, who's a researcher, and his advice was go home and wait. We're working on some things, but we don't have any answers. Fortunately, I had some good friends, and the internet's available, and lo and behold, Vincy Seaback, a real good friend of mine, came to me and said, you better listen to this lecture, and it was Dr. Baum's lecture. And my background is more engineering, but I also am a chemist, so I had a good feeling about this treatment that PRRT was all about. So Vincy, who was a hockey player, a professional hockey player, 13 years in Germany, and he knew German, and he says, "I'm going to take you to Bad Berka, because I know where it is." So the three of us went to Bad Berka, Gail, Vincy, and I, and that's where I met Josh. He was my first roommate, and at the same time Gary was there. So these are friends of mine now. So that was the start of my I think treatment for neuroendocrine cancer. So Dr. Baum always says, well, quality of life is really important. So what has this PRRT treatment done for me? Well, it's allowed me to go skiing in British Columbia, and I hope this winter I can go for another 2 months. Gail's going to scream when she sees one of these slides, but that's Silver Star Mountain in the interior of BC, a wonderful place. It's in the middle of the mountains, and we always hear and brag, I guess, as Canadians, that it's darn cold here. And in the valley between these mountains and the next range, I don't think it got colder than -8 degrees C all winter last year. And for you Americans, that's about maybe 20 F. So that's not a bad temperature. Didn't hurt us anyway. So that's what we do in the wintertime. And then last year I went to the same area in the summertime. Wonderful golf courses, so I don't brag about my golfing, but I enjoy it. So that's another picture in the same area in the Okanagan Valley, where fortunately they make some good wines too. So what else do I like to do? I still play hockey, and that's a picture of me. I'm probably gasping for air. My 70th birthday is next January, and I hope to play again next winter. So a little skiing, a little hockey, and some other things. And this is a crocodile in Africa that was grabbing some farmers' goats, and so I'm on an island there. It's a big old crocodile, and this is another thing that I do now and then. But I don't shoot lions and elephants and things like that, but crocodiles I would. And then every March in Ontario we have maple syrup season, and I love to do this too. So here we are, Gail and I, boiling, and we make about 50 gallons of maple syrup just for fun, give away, and that's another part of what we do. And it's all possible because of doctors, and not only Dr. Baum, but others as well, who have allowed me to continue to function with this disease. But what's coming ahead? Well, there's one other step that I haven't told you about. My tumors became functional. I didn't even know what this non-functional tag was until this happened. So here all of a sudden, last winter, not this past winter, the one before, I was in a hospital for 2 months. And in Peterborough, we have a brand new hospital, and nobody there knew what neuroendocrine cancer was. It's a 400-bed hospital. It's not small. The doctors just didn't know. So I had to fly by helicopter for an hour or two, about 200 miles away, to see Dr. Kocha, who is a doctor in London, Ontario, who had some knowledge about this disease and has helped me a lot, because I can't go to Germany on a moment's notice. It's not that easy. But there's nobody else around me, so I might as well go to Germany as go to London, but sometimes that's not possible. The one thing that I ended up having is chemoembolization and RFA. Helped for a while, this non-functional turning to functional tumor. But I went on the chemo, streptozocin, last fall, and it helped me, and so far I'm still holding. I'm gonna quit in a minute, Josh. So I just want to finish with a slide, though. I'm fortunate to have many resources and many friends all over the world. And I just visited the Cross Cancer Institute in Edmonton last February just to see what was happening there. I was hoping to see Dr. McEwen here, but understand he's not coming. So I have all of these resources here, but they're far, far away. And I think what we need to do in Canada is have at least a couple centers that we can count on that would help us with this disease. And we really don't have that here yet. We have a few interested doctors who have done some work, but our federal government, unfortunately, divides up our health care by province. So each province is responsible for delivering health care, and by doing so, you look at the province of PEI, you have 150,000 people in that province. They can't afford to have a neuroendocrine doctor there. So we need to reorganize our healthcare a little bit here in Canada to make it possible. And it's just not neuroendocrine tumor issues. There's quite a few other orphan diseases, and until we get an orphan disease policy here in Canada, we're going to be out of luck. I'm just fortunate to have good friends and good doctors around the world that I can go to get help, but not everybody can do that. Most people can't, and that's the unfortunate part. So I hope that we do see some movement by our government, and it's hard. It's like a big ship out there. You can't turn them on a dime. It'll take many, many years. And even I can complain a little bit about the FDA. We don't have it here in Canada, but we follow the same rules pretty much. And I don't mind being a guinea pig. If they were sitting in my shoes and they say, well, we got to protect you from a drug or whatever that may go wrong. I recall the thalidomide problem, but that was different. That was for pregnant women who were not carrying their pregnancy very well, and in the end it ended up with limbs not fully formed and the like. Not very nice, but when you're fighting cancer and the potential of not being here next year, I really don't care. I'll be a guinea pig any day of the world of the week, and I wish there was some better ways of delivering new technologies quickly, rather than taking years and years and years. And I think that's where we're at here in North America, unfortunately. Thanks for listening. I hope I've explained my challenges and some of the things that I hope get done here in Canada, and really in the United States as well, because I think we're about at the same place. Thanks.